Hi there, it's me again, Giselle, also known as Mumai, and welcome to my channel. We all know that October is Breast Cancer Awareness Month worldwide. It's an annual campaign to increase awareness of the disease. In honor of Breast Cancer Awareness Month, I am giving you this helpful guide or additional knowledge about breast cancer. I'm gonna show you this video from NBCF. Disclaimer, I don't owe this clip and other clips that will be featuring on this video, giving credits to the owner. I will leave their link below the description box. You can check it out for more information. Let's watch this.
Each of our lives is a story. We journey along a road of experiences and emotions, passing significant milestones along the way. When suddenly, the road beneath our feet takes a sharp turn, breaking from what was once certain. Breast cancer causes this break. Perspective ruthlessly shifts. You and your loved ones see the road differently than before. However, we see the road has not ended. It continues on through new hills and new valleys. We know that life has done this before, curiously forcing us into foreign places and down roads that seemed impassable. Yet somehow, these challenges become fertile soil, where seeds of strength, love, and resilience mature and grow strong. Remember, this is a road that has been traversed by thousands of women with full lives and loved ones, women whose dreams, whose lives were threatened by breast cancer. Women who now share stories of endurance and hope. It is for their loved ones to gain a better understanding of the disease and to feel a stronger sense of connection. Finally, it is for doctors to reinforce their instruction and advice.
Breast cancer awareness is an effort to raise awareness and reduce the stigma of breast cancer through education on symptoms and treatment. What is breast cancer? Breast cancer is a malignant tumor developed from cells of the breast, and it is one of the most common cancer affecting females. Take note that men can get breast cancers too. These changes can be a condition called gynecomastia, when breast tissue enlarges. Here are the causes and risk factors of breast cancer. We have here family history, gene mutation, late childbearing, early menstruation, and late menopause, obesity, increased breast density, prolonged use of oral contraceptives, hormone replacement therapy after menopause, alcohol intake, and tobacco. You can get breast cancer even if it doesn't run in your family. Most women diagnosed with breast cancer, more than 85%, have no family history of the disease. But other factors such as age, being overweight, alcohol use, and hormone therapy after menopause can also increase your risk of developing breast cancer. Let's take a look on the breast anatomy. It's important to us women to know the anatomy of our breast regardless if we are in medical field or not. With this, we can determine if there is something wrong with our breast and take immediate action to treat this disease. Again, this is not my clip. Credits to the owner. Let's watch this.
The female breast is mostly made up of a collection of fat cells called adipose tissue. This tissue extends from the collarbone down to the underarm and across to the middle of the rib cage. There are also areas called lobes, lobules, and milk ducts. A healthy female breast is made up of 12 to 20 sections called lobes. Each of these lobes is made up of many smaller lobules, the gland that produces milk in nursing women. Both the lobes and lobules are connected by milk ducts, which act as stems or tubes to carry the milk to the nipple. Also within the adipose tissue is a network of ligaments, fibrous connective tissue, nerves, lymph vessels, lymph nodes, and blood vessels. The lymph system, which is part of the immune system, is a network of lymph vessels and lymph nodes running throughout the entire body. Similar to how the blood circulatory system distributes elements throughout the body, the lymph system transports disease-fighting cells and fluids. Clusters of bean-shaped lymph nodes are fixed in areas throughout the lymph system. They act as filters by carrying abnormal cells away from healthy tissue.
This is the anatomy of the normal breast. We have here the chest wall, pectoral muscle, lobules, glands that make milk, nipple surface, areola, lactiferous duct tube that carries milk to the nipple, fatty tissue, and the skin. On this image, we have here the anterior and lateral side anatomy of the female breast. What is breast cancer? How does cancer forms? What are the types of breast cancer? This is best explained in this video, again by NBCF. Let's watch this.
Healthy cells are the basic building blocks of all tissue and organs in the body. But when cell DNA, the cell's wiring, is damaged, mutated cells begin to rapidly reproduce without following the pre-wired plan. Aggressive cell growth can form a tumor or mass of tissue that, like each individual cell, does not function as originally intended. These abnormal cells, or group of cells, can progress into the disease known as cancer. Breast cancer usually begins either where the milk is being produced, the lobules, or in the milk ducts. Lobular carcinoma in situ, LCIS, is a precancerous condition that forms and is contained in the lobules. Invasive lobular carcinoma is a type of cancer that develops and breaks through the lobules, with the potential to spread to other areas of the body. Ductal carcinoma in situ, DCIS, is a type of cancer that forms in the milk ducts and is considered non-invasive because it has not spread to any surrounding tissue. If the cancer has spread beyond the milk ducts, it is known as ductal carcinoma. Less frequently, breast cancer can originate in the stromal tissue, the fatty and fibrous connective tissue of the breast. Treating breast cancer as soon as it's discovered is very important. If left untreated, the cancer cells may invade healthy breast tissue or lymph nodes. Once in the lymph system, cancer can spread more easily to other parts of the body.
Breast benign tumors. Common benign causes of breast lumps are fibroadenoma and cystic breast changes. Fibroadenoma is the formation of scar-like tissue, solid but not cancerous breast lumps that occur most often in women between ages 15 to 35. Cystic breast changes lead to the development of fluid-filled round or oval sacs, which can make breast feel tender or lumpy. Most breast lumps are benign, which means they are not cancer. Benign breast lumps usually have smooth edges and can be moved slightly when you push against them. There are several common causes, including normal changes in breast tissue, breast infections, or injury, breast tissue changes during a woman's entire life. Breast with malignant tumor. A tumor is a mass of abnormal tissue and those that are cancerous, which are malignant. Malignant tumor occurs when some breast cells begin to grow abnormally. Cells may spread called metastasize through your lymph nodes or other parts of the body. Breast with mastitis tumor. Mastitis tumor is a condition in which the breast becomes inflamed due to an underlying infection. Symptoms may include fever, headache, a lump in the area, thick whitish nipple discharge, and abscess or collection of pus in the area. Did you know that tumors have grades too? Let's watch this video from NBCF to understand more about the types of tumors.
Remember, a tumor is a mass of abnormal tissue. There are two types of tumors: those that are non-cancerous, or benign, and those that are cancerous, which are malignant. When a tumor is diagnosed as benign, doctors usually leave it alone rather than remove it. Even though these tumors are not aggressive toward surrounding tissue, they may continue to grow, pressing on organs and causing pain or other problems. In these situations, the tumor is removed, allowing pain or complications to subside. Malignant tumors are cancerous and aggressive because they invade and damage surrounding tissue. When a tumor is suspected to be malignant, the doctor will perform a biopsy, a diagnostic procedure, which we will cover in subchapter 4.3, to determine the severity of the tumor. Metastatic cancer is when cancer cells of a malignant tumor spread to other parts of the body, usually through the lymph system, and form a secondary tumor. Tumor grading is a system used to classify a malignant tumor based upon the severity of the mutation and the likelihood that it will spread. According to the National Cancer Institute's tumor grading system, there are 4 grades: low grade, 1, intermediate grade, 2, and 2 types of high grades, 3 and 4. Grade 1 tumor cells, for example, are the least aggressive in behavior. They still resemble healthy cells and multiply at a slower rate. Higher grade tumors tend to grow and spread more rapidly than tumors of a lower grade. Tumor grades are not to be confused with cancer stages.
Why and how we can get cancer? It could be genetic or environmental, or in most cases, a combination of the two. But most patients will never know exactly what caused their cancer. However, there are certain established risk factors that are associated with breast cancer. Diagnostic method. The initial sign of breast cancer may involve a new lump or change in the breast, a new nipple inversion, an area of significant irritation or redness, dimpling or thickening of the breast skin, and persistent breast pain or discomfort are reasons to seek prompt medical evaluation. A breast self-exam is an examination of the breast for changes or abnormalities. Becoming familiar with your breast and knowing what is normal for you will help you detect changes or abnormalities if they occur. Self-breast exam should be performed monthly, and any changes or abnormalities should be discussed with your doctor or physician. The best time to do a monthly self-breast exam is about 3 to 5 days after your period starts. Do it at the same time every month. Your breasts are not as tender or lumpy at this time in your monthly cycle. If you have gone through menopause, do your exam on the same day every month. You can screenshot this and keep it as your guide on your DIY breast examination at home. Clinical breast exam. A clinical breast exam is an exam performed by a qualified nurse or doctor. They will check for lumps or other physical changes in the breast. The goal is to detect breast cancer in its earliest stages, either by evaluating the patient's symptoms or finding breast abnormalities. Radiologic examinations of the breast. These examinations are held in a diagnostic clinics or hospitals. It may use ionizing radiation, high-frequency sound waves, or strong magnetic field. These imaging modalities can help diagnose the early stage of breast cancer. Breast mammogram. Having a regular scheduled mammogram, the standard diagnostic scan, is especially important. A mammogram is an X-ray. Breast is exposed to a small dose of ionizing radiation that produces an image of the breast tissue. If your mammogram or a clinical exam detects a suspicious site, further investigation is always necessary. Although lumps are usually non-cancerous, the only way to be certain is to obtain additional tests such as an ultrasound. Ideally, mammogram is for ages 40 and above, but it can be done in some cases, like if you have family history of breast cancer with signs and symptoms. Breast ultrasound. Breast ultrasound uses high-frequency sound waves to produce images inside the breast. It also assesses the size and shape of the lump and to determine whether they could be tumor's growth and fluid-filled cysts. If a solid mass appears on the ultrasound, your radiologist may recommend a biopsy, a procedure in which cells are removed from the suspicious area to check for the presence of cancer. Ultrasound are helpful when a lump is easily felt and can be used to further evaluate any abnormalities discovered on a mammogram. When your initial exams are not conclusive, like physical exam, mammogram, and ultrasound, your doctor may recommend an MRI to assess the extent of the disease. MRI, magnetic resonance imaging. An MRI is a scan of the body that uses magnetic energy and radio waves, rather than radiation, to view organs and tissues in the body. In some cases, MRI are requested after breast biopsy. Why? A breast MRI usually is performed after you have a biopsy that's positive for cancer and your doctor needs more information about the extent of the disease. For some people, a breast MRI may be used with mammograms as a screening tool for detecting breast cancer. 5 standard options to treat cancer. Surgery and radiation, which is local, targeting just the area around the tumor. We also have hormone therapy, chemotherapy, and targeted therapies, which is systematic, targeting your whole body with cancer-fighting agents. Most women receive a combination of these treatments. Your treatment plan will be based on stage of cancer, type of cancer, age, health, menstrual and menopausal stage, and history. How can I reduce my risk of breast cancer? You should limit alcohol, don't smoke, control your weight, be physically active, breastfeed, limit dose and duration of hormone therapy, avoid exposure to radiation and environmental pollution. Remember, your health is in your hands. Conclusion: breast cancer can be detected in the early stages. Breast cancer can be treated effectively. Breast cancer, when it is most treatable, does not produce any symptoms. Therefore, be diligent with breast health. I hope you've learned something in this video. These are all basic information only, and again, disclaimer, I am not an expert. Still, if you have some doubts about it, you can talk to your doctors to enlighten and educate you more about the risk and factors of breast cancer and how to take care of your breast. If you like this video, don't forget to give me a thumbs up, click the subscription box, and hit the bell button for more upcoming videos. See you again next time, guys. But before I end this video, I would like to share this clip from Kingsborough Community College on how one touch can save your life forever. Wash your hands, mask on, and keep distance. God bless everyone. Take care.
All it takes is one touch.
One touch can change your life forever.
All it takes is one touch. One touch that can make the difference between life and death.
All it takes is one touch.
One touch to discover that you have breast cancer.
Get screened.
All it takes is one touch.